Bartholomew Town is brought to you in part by the University of Rhode Island Online, Navigant Credit Union, the Audubon Society of Rhode Island, Newport Film, and Half Street Group.
Bartholomew Town.
Rhode Island's healthcare system is in crisis, exacerbated by the announcement that Anchor Medical Associates will be closing all of its locations by June 30th of this year, a decision that will impact approximately 25,000 patients across its offices in Providence, Warwick, and Lincoln. This puts strain on an already stressed system, something that Attorney General Peter Nerona has described as being in a true state of distress and failing. Today in Bartholomew Town, we speak with two people who are in the thick of this crisis, Dr. Christy Pacheco and Mark Glovasky of Blackstone Valley Community Health Center.
Hi, I'm Christy Pacheco. I'm a family physician and I'm the CEO at Blackstone Valley Community Healthcare.
Good morning. My name is Mark Glovasky. I am the COO over here at Blackstone Valley. And Bill, again, thank you for having us on this morning.
Of course. Well, let's start with a basic question for each of you to fill in the blank here. The state of healthcare in Rhode Island is?
I think it's fair to say we're in a crisis. Just to give you a little context, Blackstone is a federally qualified health center. We get federal funds to help care for the underserved. We serve 21,000 patients in the Pawtucket and Central Falls area. Those federal funds are now up in the air. We're not sure what kind of funding we can expect when we reapply for our grant in August. About half of our patients are at the federal poverty level, and many, like about 2/3 of our patients, are Medicaid recipients, and we are paid through Medicaid. With the current Republican plan to cut $880 billion, we're pretty worried about Medicaid and what's going to happen with our revenue and our organization moving forward. I guess the other piece I would say is that health centers, FQHCs, care for 1 in 4 Rhode Islanders. That's a lot. That's a lot. And I have to say, it's really worrisome to think that any one of us could be in a position where we can't take care of patients the way we have before.
Right. The impact on the practitioner side is something that isn't necessarily discussed at the forefront, but there's an ethical piece to that as well. We can get into sort of the circular impact here. Mark, same question though, from your standpoint, from the executive branch, if you will. How do you describe the state of healthcare in Rhode Island right now?
I would have to mimic what Dr. Pacheco just said. We are in a crisis, especially in light of Anchor Medicine now closing their doors with 25,000 patients. So we're kind of in a mode right now of how many can we take? How many locations can we take that? We've just, our Central Falls location, which I am at today, we were at one point when I first started a few years back, I want to say we had 3 or 4 providers on the floors. Now we have probably have at least 12 to 13. So that being said, we have a big demand in Central Falls just because of most of the Central Falls folks don't have transportation. That being said, we have to have accessibility. So as of today, we've opened up our Express Health to all patients. When I say all patients, if you see a PCP elsewhere, you want to be seen for a sore throat or what have you, come on in the door, we'll take you in. So that is kind of what we're in, that kind of mode right now. Just we're reaching out. Dr. Pacheco and I have been doing a lot of outreach to our community members, to the mayor's office of both Pawtucket and Central Falls, just letting them know, hey, we're here. Whatever we can do to help, we're trying to do that at this point.
I guess the other point I'd make about that is there's really only one other primary care office in Central Falls, which is a big change over the last 20 years. There's a Jenks Park Pediatrics, which is great, but that's it. It's Blackstone or Jenks Park. That's it. And so we had to find a way to be able to take more patients. And we are hiring, and we are expecting, I think is it 4 or 5 new primary care providers in the next 6 months, which is great and amazing. And we're so lucky to have that. But it remains a little bit of a question mark, what's going to be happening for us financially, no matter how many patients we see.
It's something that ties into a broader conversation, obviously this moment when we take a look at from the standpoint of federal funding, but more broadly speaking, there's been a doctor shortage, a primary care shortage in Rhode Island for quite some time. And one of the things we hear so often about is reimbursement rates here in the state. This impacts dental, this impacts family medicine, for however you want to put it. So right now, you're sort of defying the odds there by being able to bring on new practitioners at Blackstone Valley. But in general, outside of the context of the moment with what we're seeing out of Washington, what's the general appetite for medical expertise to work in Rhode Island right now from your standpoints?
I mean, I think that depends what you're talking about, right? I think patients are hungry. I think those of us who work here are hungry for more help and more support. But the reality is, and you'll hear this from my colleagues at the other health centers, in Massachusetts, just a few miles away, you can make $30,000, $40,000 more a year. So it's really hard to attract and keep people in the state.
Mark, what can be done about that from your seat?
And that goes for Connecticut as well, too. We've been seeing a lot of people, Connecticut is not that far as well, to Dr. Pacheco's point. I just think we can offer more opportunity in regards to their schedules, I think is a big thing we're trying to offer. Just, the amount of patients per day and the administration time that they get to finish their notes or paperwork, what have you. So I just think that is something we're really trying to push to see if we can get those providers that maybe, they live in Rhode Island, but they see that opportunity in Massachusetts or Connecticut. And we can say, well, maybe we can give you a little bit better of a schedule, which, as we all know, definitely influences someone's decision when it comes to employment.
So we see for sure that this healthcare crisis is playing out in Rhode Island, and we know that our neighbors are having a little bit of a different picture when we talk about Massachusetts and Connecticut. On a national basis, where does Rhode Island stand in relation to outside of the region right now? And is there anything that we can learn from other regions that have suffered similar issues with reimbursement rates and the impact of a 25% of overall patients using these types of health centers for their primary care physicians?
So I can tell you that New England is one of the highest cost of living areas. I think the only other place that's as high is Northern California. If you practice in the Southeast or the Midwest, you'll find that your salary is higher and it can buy a lot more. You can buy a much bigger home, you can have a lot more comforts. And so I think that's part of the problem, but that's a much harder problem to fix. I don't know if you want to add anything to that, Mark.
It's a tough question because, you're fighting with those opportunities in Massachusetts and Connecticut. I just think Rhode Island is a small state. We have a lot of opportunity here for growth. We have the patients that are out there that need to be seen. We have a very good Brown health system that we do get a lot of MDs and practitioners out of. So, those opportunities and just working, it's a beautiful state, a lot of beaches. So that opportunity also arises. So I just think, again, just selling our product and just knowing that there are patients out there to be seen. And especially in a situation like we have here, we make a difference. We really do on a day-to-day basis.
I think the other piece is trying to retain the physicians who are graduating their residency, who are already here, who already are in Rhode Island, who already love Rhode Island, whether it's, the weather or the beaches or the mix of everything, the art scene, whatever it might be. I think the goal for us has been to try to hire people who are already here. It's a little bit difficult for us to hire folks from other parts of the country because of the cost of living versus salary, issue, with the exception of, we have a global health fellowship. We've done a lot of different teaching things through Brown University. So for folks who are interested in doing that kind of work or are very mission driven, really want to work with an immigrant population, then, we can recruit those folks. But generally speaking, I'm not sure that we're recruiting nationally right now or necessarily have that in mind.
You tapped into something there that I think is really interesting, which is we certainly, obviously Boston is, when you think meds and eds, you really think Boston on a global basis, but we're certainly no joke here in Rhode Island between Brown University and we now see a medical school coming online at the University of Rhode Island. And just on a regional basis, there's an appetite for people to be here, let me rephrase that. When people think good healthcare, they probably think Northeast United States. And it reminds me a bit of the arts and creative sector, where we have RISD, a global leader, and to an extent Brown, and to an extent URI, and so on and so forth. And we see a massive amount of brain drain, whether it's industrial design or fine arts. It's hard to retain people who have these world-class skills after they graduate here in Rhode Island. Every once in a while, you get somebody who stays. So how much of this is the macro as well when we talk about the state of Rhode Island right now, lowercase state, the condition of Rhode Island with respect to housing, transit, Providence schools? Are these factors that are impacting your ability to be able to hire or retain staff?
For sure. I mean, the housing is really expensive and fairly scarce. Most of the time when we're talking about housing, we're talking about our patients' housing, and that is also a nightmare. But I think for folks we're trying to recruit, I'm on a mom doc listserv of 750 moms who are physicians in the area, and it's very frequent that people are looking for an apartment, and what they can afford to pay, especially as a resident, versus what is available is incredibly limited. I forgot the other question you had.
Well, just in general, the piece of everything from the Providence schools to transit, the kind of litany of issues that people can list off about Rhode Island.
Transit's a big issue, again, for our patients and also for the folks who work for us. The RIPTA system isn't super easy to use. And, basically, if you don't have a car, you're a little bit out of luck. A lot of our patients walk everywhere because I think the prospect of taking 2 buses to get to Providence from Central Falls, especially if you're pregnant and have other small children, is too daunting. And then, you can call an Uber, but are they going to have all the appropriate car seats for your kids? Probably not. So people just don't go. And that's part of the reason we've been trying to draw specialists at least part of the time to work in our Central Falls location, because it is such a barrier for our patients, but it also is a barrier, I think, for the folks who we try to recruit to work here.
Mark, similar sentiments on the macro impact here?
Yeah, no, I think we also, Bill, we're also reaching out and working with, the Care New England's, the Brown Medicines of the world, just trying to work in collaboration with their residency program, and just thinking outside the box is what we're really trying to do, just to keep those, they finish their medical schooling or their residency here, just trying to keep them in Rhode Island. Especially if they're homegrown, we really like to see them continue their career with either us or, again, with Care New England or Brown Medicine that we're working in collaboration with.
But I think that's also true of our nurses. That's also true of everyone, right? But one of our one of our main managers in Central Falls purchased a home very close to our health center in an effort to just be able to walk to work. I think that's a big factor for people.
Absolutely a big factor in general as we move forward here in the state, something that even from a housing standpoint, there's legislation that has incentivized building housing close to transit. It's part of our big plan here. Obviously, medicine plays into that. With the closure of Anchor Medicine, or the impending closure of Anchor Medicine, 25,000 patients will be without their doctor. It's a shocking number. It impacts a lot of people across a lot of different walks of life here in the state. And we saw Thunder Mist Health Center, which has practices in Wakefield, in Woonsocket, and in West Warwick. They're basically looking to absorb some of that. How, on a community basis, are other institutions going to be able to absorb, practically speaking? You've talked about adding practitioners to what you do. In general, is Rhode Island prepared to absorb 25,000 patients on the whole, or is this just really hitting the accelerator as the cliff is looming here in this crisis?
I mean, for me, it feels like a free fall at this point, right? Like we've already made it over the edge. The fact is that before this Anchor situation, we were getting requests 10, 15 a day here at Blackstone. And again, going back to my mom doc listserv, probably 1 or 2 times a week, we'd get an email for a doctor trying to find a doctor for herself and coming up empty. And so there just isn't a lot of capacity here. And part of the reason that really worries me is because, as I said, with the federal funding in question, and the question around Medicaid reimbursement, we also have this issue with our 340B program. So the 340B program was enacted in the 90s in an effort to get patients low-cost drugs, but to also be a revenue stream for health centers to be able to maintain our operations, given so much of what we do is unreimbursed. And we've seen millions of dollars cut from each health center with all the restrictions the pharmaceutical companies have placed on the program in an effort to keep more of the profits themselves. And so, we're being hit on every level at this point in terms of revenue. And I can't emphasize enough, 1 in 4 Rhode Islanders is seen by a health center. We have 21,000. Thunder Mist probably has somewhere around 65,000.
Right.
Providence has 80, almost 90,000, I would guess.
Yeah.
That's a lot of patients. That's 250,000 patients. We're trying to absorb Anchor, but we also need to make sure none of us collapse. And that's part of, I think, the urgency and the crisis here. We are the safety net for when places like Anchor go down.
That's a heavy statement, and it makes complete sense given the moment. We see a piece of legislation defending Affordable Prescription Drug Costs Act, and this is Senate Bill 0114 for the policy nerds out there. What's important about this piece of legislation in terms of solving what you just laid out there, Doctor?
I think it's a matter of millions of dollars for the health centers, right? And so we are at risk in all of our lines of business, all of our revenue streams at this point. There's another bill right now in the House trying to help our Medicaid rates catch up with our costs. So we submit these cost reports, and we've so far been denied increase in our rates, which is a big issue. But the 340B program was an unexpected hit. So millions of dollars for, I think I heard $5 million in 1 year for Thunder Mist, don't quote me here, but several million for Providence over the course of the last 4 years in their testimony last week. We are faring a little bit better, and that's because we own our own pharmacy. But we also have all the costs associated with this pharmacy. We love having our own pharmacy. We love having our pharmacists and our pharmacy techs, but we're covering their salary, their benefits, the cost of all the equipment, the computer system to run. It's not free. But if we didn't have our own pharmacy, we would be like the other health centers where you're only allowed one pharmacy for each drug manufacturer. And that means that if a patient is on multiple drugs from multiple different manufacturers, they would be traveling all over the state in an effort to get the 340B discount that we can get at our in-house pharmacy. That's a big problem. It doesn't just hurt health centers, of course it does, but it really hurts patients, and it hurts a lot of patients whose health centers carry or cover a large geography, because if you're trying to cover, Wakefield and Woonsocket, and you've got to pick one pharmacy, that one pharmacy is not going to be anywhere near any of your sites. And it's a problem. And as we just talked about with the transportation issue, essentially that means patients just aren't getting their medications.
That's not a good place to be, clearly.
No.
Is Rhode Island's government doing enough? We know that Attorney General Peter Nerone has been outspoken about this for years. He's taken some action as well, certainly when taking a look at what he described as what would have been a monopoly between Lifespan and Care New England's potential merger. What about Governor McKee? Has he done enough here to make this a top priority? I haven't seen much happening from the governor. I think he certainly is investing in the loan repayment to keep homegrown
medical professionals here. I've not really seen anything in terms of the 340B program or the Medicaid rates. We've done some outreach to him about the Medicaid rates and have not really been very successful. So this is why, we're trying to go through the legislature for both of these issues at this point.
What should people know that are hearing this right now? Maybe they currently are still locked in with their provider. Is this a statewide issue that everybody should be worried about?
It sure is.
Yes, it is.
It sure is, because it's also not just the health centers. The 340B issue is also the safety net hospitals, so that includes Women and Infants, Kent, and Landmark. So they're also able to offer 340B discounts, but again, it's only one pharmacy, and it's one pharmacy for each manufacturer, which means it may be multiple pharmacies for you, which is it's kind of a nightmare. And again, as I said, if any one of us crumbles, the whole system falls apart. Not one of us could absorb a Thunder Mist, a Providence, a Well One, or a Blackstone. Nobody's in a position to do that, especially after Anchor Medical.
Right.
Dr. Pacheco, Mark, thanks so much for your time today. Really appreciate it. Major crisis here.
Thank you, Bill, for having us.
Much.
Hey, thanks for stopping by Bartholomew Town. For more content, follow me on Instagram @Bill Bartholomew.